Did you know that 1 in 5 people will develop skin cancer in their lifetime? And that skin cancer is the most common type of cancer in the world, with 73 million cases of skin cancer diagnosed just in 2014? If these statistics surprise you, you're not alone. And that's exactly why we're going to spend some time with the skincare specialist right here at Gainesville Dermatology.
Gainesville Dermatology is made up of 2 different centers. We have the Gainesville Dermatology Skin Surgery Center and the Gainesville Dermatology Aesthetic Center, so we can offer complete skincare options.
The statistics surrounding skin cancer are really quite daunting.
Absolutely. Unfortunately, in the last 30 years, we've actually seen the rates of melanoma, which is the most fatal of all skin cancers, double. We're seeing more sun exposure on our skin. We're spending more time outdoors. And also, we do believe a large part is tanning beds, unfortunately, which is why you see that we're classifying it as a carcinogen, something that causes cancer.
Are all skin cancers the same?
So no, in fact, we have 3 main types of skin cancer. The first type of cancer, basal cell skin cancer, in fact, turns out to be the most common cancer in the entire world. Second form of skin cancer, called squamous cell carcinoma, behaves a lot like basal cell. And the third, the deadly form of skin cancer, called melanoma.
So then when we think about prevention, what is available for us?
Well, first and foremost, protecting yourself from the sun, and those are things such as broad spectrum sunscreens, hats, sunglasses, wearing protective clothing, making sure that you do see your dermatologist once a year to be evaluated. You know, we recommend that people be evaluated at some time during their childhood. Assess as a dermatologist how often we want to see you to look at those moles. And then at least by the age of 25, we want to see you once a year.
Dr. Whitmere is my hero. I came in to get something checked on my hand and she did a body scan, found a spot on my back, scraped it off and sent it off, and it was malignant. I saw a surgeon, had it removed. That was 4 years ago. I come in every 3 months for a body check. I recommend everyone doing it, especially living in Florida, whether you sit in the sun or not.
We actually have many options to deal with these cancers, and they're highly curable if caught early. So first and foremost, we come up with non-surgical options, and that depends based on where the cancer is located and what type of cancer, and your dermatologist can determine that for you. And then in addition to that, we are actually pleased to offer a treatment for skin cancer that actually has a 98% chance of cure, and that's the state-of-the-art Mohs surgery.
Mohs micrographic surgery is a highly effective skin cancer removal technique that we use in our office to remove most basal cells and squamous cells on the face or of sensitive areas. It's typically about a 1 to 2 millimeter margin around that area, so you're preserving as much normal skin while removing the skin cancer, and it's all processed in the office while it is being taken care of.
Are there other skin conditions you're able to treat?
Absolutely. As a dermatologist, we are trained to treat any condition that affects the skin. Acne and rosacea, eczema, psoriasis, warts. We're some of the leaders in things such as Botox, cosmetic fillers such as Radius, Restylane, Juvederm to plump wrinkles in the face. We also offer laser hair removal, and we're proud to be the premier body sculpting center for this area.
I always kind of had a bulge around my abdomen that I was really self-conscious about. I didn't really feel confident wearing a bikini on the beach, and I heard about Cool Sculpting, and I heard about VeloShape and UltraShape, and I figured why not check it out and see, if it works, because the pictures were pretty convincing. So far I've seen phenomenal results. They say that you're not supposed to see results for several months, but it's only been maybe 2 months for me. Results are through the roof.
Seems like these procedures are really geared to self-confidence and boosting that.
Absolutely. We completely believe in healthy skin, healthy body.
Contact the skin specialist at Gainesville Dermatology. You can find them online at GainesvilleFloridaDerm.com.
Janice Thomas, Janicethomas.
Parisa Amirzadeh. So that's.
I think we're having you spell it.
Yep. So it's P as in princess, Arisa, and then my last name is Amirzadeh, A-M as in Mary, Irzadehasl.
Say it again.
Amirzadeh.
Amirzadeh, and it's A-I-R?
A-M-I-R.
A-M-I-R.
Yep.
Amirzadeh. Okay.
Very
cool.
long.
Very cool. All right, so
Have you saying spell your name for the camera?
So Erica Canova, Ericacanova.
And do we need anything before or after? Any
MD.
Miranda Whitmer, Miranda Whitmer,
MD.
MD.
All right.
I was a gymnast for a good part of my life, and I did a lot of sports growing up. I did soccer, I did track, I did like everything, you name it, swimming. I was very active, and even like in college I was pretty active, but I always had kind of like a little bulge around my abdomen, and I never really liked it. It always bothered me. I had like self-conscious problems, like going to the beach. You know, I would always feel self-conscious about it. Like I was aware of it, I knew it was there, and I just didn't like it. And so far I've had 2 different procedures done. One is Ultra Shape. I've had that done twice, and I've had Cool Sculpting done once. The results I've seen around my abdomen and my love handles is just phenomenal. I'm more than happy, more than pleased. First session of Cool Sculpting and Ultra Shape I've had done was probably about 2 months ago. And I'm just more than pleased with the results I've had. Like even immediately I was able, you know, to look in the mirror and see like, wow, like my stomach is a lot flatter. Like my love handles don't, you know, I don't have a little muffin top over my jeans. And I do have like that self-confidence. Like when I go to the beach and I'm in a bikini, like it's just, I don't feel self-conscious about my body. I definitely have like more self-confidence like when I talk to people, like, you know, when I get dressed in the morning, you know, I wake up happy, like when I'm trying to find outfits to wear, it's not like, oh, like I look fat in this, or oh, like you can see a little bulge around my abdomen. You know, everything looks good on me now. Like when I go shopping, like I don't have a problem finding anything. I don't think like, oh, I look fat in this.